The World Health Organization says there is an urgent need for countries to enhance action to prevent viral hepatitis infection and to ensure that people who have been infected are diagnosed and offered treatment. July 28th is World Hepatitis Day, and this year the WHO is focusing particularly on hepatitis B and C. Together they cause approximately 80% of all liver cancer deaths and kill close to 1.4 million people every year. The WHO is alerting people to the risks of contracting hepatitis from unsafe blood, unsafe injections, and sharing drug injection equipment. Some 11 million people who inject drugs have hepatitis B or C infection. Children born to mothers with hepatitis B or C and sex partners of people with hepatitis are also at risk of becoming infected. The organization emphasizes that hepatitis can be prevented. Stephen Victor is team leader of WHO's Global Hepatitis Program.
We have in hand today all the tools that we need to prevent new hepatitis infections and prevent hepatitis deaths. We know how the virus is transmitted. It's transmitted primarily through blood and through bodily fluids. And to prevent it, we have 4 key messages that we're promoting. One is get informed, find out about the routes of transmission and what can be done. Get vaccinated. There's a very effective hepatitis B vaccine that can protect for your whole life. Demand safe injections. Many infections of hepatitis B and C occur in healthcare settings because of syringes and needles are reused. So we want people to be aware of this risk and to make sure that the injections that they receive are with sterile, new syringes. And lastly, get tested and get treated.
A cataract is a clouding of the lens in the eye leading to a decrease in vision. They may affect one or both eyes and often develop slowly. The World Health Organization says 285 million people are estimated to be visually impaired worldwide. 39 million are blind and 246 have low vision. About 90% of the world's visually impaired live in low-income settings, and cataracts remain the leading cause of blindness in middle and low-income countries. Most cataracts are related to aging, although occasionally children may be born with the condition, or cataract may develop after an injury, inflammation, or disease. Now, HelpMeSee is a global campaign to eliminate blindness caused by untreated cataract. Joining us from our studio in New York is Jacob Mohan Thazhathu, President and CEO of HelpMeSee. Mr. Thazhathu, welcome to Africa 54.
Thank you very much.
So your organization has been working around the world trying to reverse cataract, and Africa has been on your agenda in countries like Togo. Now you are in Madagascar. Tell us about what you are doing there, this new campaign you're launching in Madagascar.
Africa is an emerging continent of the 21st century with 1.2 billion population and about 6 million people, and according to our estimates, blind due to cataract. In Madagascar, among the 21 million people, we estimate there are at least about 1 million people who will need the support for cataract surgery in the next 5 to 6 years. And our goal is to eliminate cataract blindness in Madagascar. And we just launched the Madagascar campaign 2 weeks ago. Our goal is to train, and the first goal is to train at least about 15 to 20 cataract surgeons in Madagascar in partnership with the Ministry of Health, the Lions Club in Madagascar, the Lions First program, and with the HelpMeSee technology. The HelpMeSee technology is based on simulator-based training. The simulators are aviation-grade, high-fidelity simulators which can train cataract surgeons to proficiency, and along with our surgical kit technology, which eliminates the infection rates, introducing the community-based surveillance system. Okay. We expect to achieve that in Madagascar.
Okay, now what type of challenges have you come across as you work in these countries?
The biggest challenge is lack of adequately trained cataract specialists. The medical surgical training requires to be significantly improved, and there are very, very few number of surgeons against the number of population who requires those surgeries. Generally speaking, in most of the countries in Africa, there is less than one ophthalmologist for a million population. That need to change.
And you will have achieved about 200,000 surgeries, am I correct, in Madagascar?
That's correct. HelpMeSee has supported 200,000 surgeries, and the 200,000th surgery was done in Madagascar in the hospital in Antananarivo by Dr. Amy and one patient, Madame Florentine, living in Antananarivo. Now, that's a level of information that we can provide to the local surgical partners and to the local community so that they can solve the problem.
Okay, thank you so much for joining us, and good luck in your work. And that was Jacob Mohan Thazhathu. He's President and CEO of HelpMeSee.